Great. Mark?
Oh, look, I didn't have this.
Oh, my God. I just have a.
So did you guys call the order
I got
this
kids,
morning?
so I gotta work. Great.
Get out of the car.
That's funny.
Gotta get.
Yeah, I am up early, David.
Sorry, just keep.
I know that. Good morning, Jim. You were so quiet in here. I already talked about you.
Jim, stay up.
Hey, just stay up.
I think it just. States. And a few. Just. I think.
That's it.
Good. Okay, welcome. Very first thing we need to do is to approve the agenda. So moved. It's been moved
I'll second it.
and seconded. Discussion. All those in favor say aye.
Aye.
Aye. Opposed, the motion carries. This time is set out for public comments. On county business topics to be recognized, to raise your hand or stand after recognition from the chair, state your name and address. You may speak one time per issue. If the comment is not on an item on the agenda, please understand that the Board of Supervisors will not act on your comments at this meeting due to meeting law requirements. Your board meeting posting on the agenda. The chair and board members welcome comments from the public. However, all comments must be directed to the board and not others in attendance. Keep your comments germane. It is not appropriate to use profane, obscene, or slanderous language. No personal attacks will be allowed. The chair may limit each speaker to 3 minutes. Does anybody wish to speak?
I do. My name is Liz Childers. I've lived here for 58 years, and I'm not worried about the county's done well, but the one thing they have done is take care of me. I have twice used the Tama County services. Had I not done that, it would have cost you a lot of money, because I would have been in a care facility, you would have been paying, I would have been paying. They stopped 3 times a week, couldn't have better people working for me. And if I were do too well right now, and I might need them again. To me, cutting them 24%, find it somewhere else. That's what I came to say.
Thank you.
My name is Justin Jensen. I'm with Senator Joe Nier's office. I just wanted to share my contact information. I spoke to Representative Wolf. I found out through him that the entire Board of Supervisors knew, so I just want to congratulate you and thank you for your service to the county. My grandpa was the mayor of Hudson Island for a number of years, so I understand service is really important, especially at the local level. So I was going to share my contact information in case there's ever federal issues that come across your plate. So thank you for your service.
Thank you.
Thank you.
Anybody else?
Will this afternoon's meeting be on, Teams? Sorry, well, guys, this afternoon's a health, work session budget meeting be on Teams?
Work session with both of them.
Yeah.
Where the, their office, I don't know if they have the capacity. But
Hi, I'm Linda Opperman, 806 Beautiful Street. My husband is 100% disabled, Vietnam veteran from Agent Orange. I used their services for months until he went to the veterans home. I would have been dead by now if I hadn't had their help. They are immensely important in this community. And when you think about letting people that really need the help leave, there's a problem. Don't do it.
Thank you. But they, okay, go ahead.
Will there be public comment during the work session of the public health meeting?
I don't think so.
It was on the agenda.
It is on the agenda? Okay, yes, then. Yes. Sure. Session doesn't say.
Says work session.
Oh, well. Okay, I mean, there is public comment, or, I just like to say I'm Janet Wilson. My mother, Martha Baker, lives in Dicer. And when you talk about what's essential and non-essential in the county, it depends on whose shoes you're standing in. For her, staying in her apartment is hugely essential. She spent about 4 months in the skilled care in a nursing home and getting back to her own place, her own apartment, which is life-changing for her. So, you know, if you could, everyone's gonna have to have a cut. I realize how the finances, but if they're equally cut, that would be better than what you deem non-essential. So I guess I would just remember that what some people think is essential might be different than others.
Thank you. Good.
Mark Kriegel, 720 Street, Tama. You proposed a big cut with public health. I don't know any other way to do that than to cut employees. And every one of those employees generates income. So I don't know how you're gonna cut expenses without cutting income. So I think you have to be really careful if you're gonna cut something out of that department without cutting revenue for the county also. So if you cut whatever it was, so you're actually cutting more money out of the budget than just that. You're cutting income out of the budget also.
Great. Thank you.
So I understand we're not, there, it won't be open to the public to speak even on our behalf, like for us to speak at this afternoon's meeting, is that correct?
I'm not opposed to opening it up for comments. It's just not on the agenda.
It is on, it's on the agenda you have on the hallway.
As long as
Oh, it is?
it fits well with the Board of Health, I mean, if they have time, I know they're busy, like, we don't care if people talk, that's great, you know, but let's let Board of Health kind of decide what they want to do there.
Does also have Zoom links, so I just saw that.
Oh.
But it's on the public health.
Okay, perfect, so it will be Zoom then? There's a link on it?
From their actual setup.
Yep, okay,
Okay.
good.
If not, we'll open it up at the end of the meeting again for public comments. Close public comments at this time. Next on the agenda is to discuss and approve the 3/10/25 canvas minutes and the 3/10/25 regular minutes and the 3/11/25 minutes. So moved. It's been moved.
I'll second it.
Been moved and seconded. Discussion. All those in favor say aye. Aye. Motion carries. Discussion and possible action to approve Presbyterian Church use of the courthouse lawn for Easter event on 4/19/25. We got an application on file. I think that, that meets the requirements from the previous board.
The deposit prior to have them straight punch, and then as long as the director let in or
I'll make a motion, we accept it.
I'll second it.
Yeah, it's been moved and seconded to approve the Presbyterian Church use of the courthouse lawn for Easter egg hunt on April 19/25. All those in favor say aye. Opposed, motion carries. Engineer.
Morning.
Good morning.
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 So last Wednesday, we started, contract rock hauling. This should be close to finish up this week, with the
Do we
rains.
have a microphone? Did you have any?
Thank you.
This last Wednesday started contract rock hauling, they should be close to finishing up this week, looks like Wednesday. Might set it back a little bit, so, whatever weather we're getting there. And then, our phone guy, and once contract rock is done, then pulling out Garrison, in there, moving the water this south, we'll be starting to back to here and then west includes here. Replaced a culvert last week on our avenue, between 190th, 195th. I didn't quite get it in, this week for the final plan for E66. I have it on the office report here, but I'll be have to be done next week. That's all I have.
Yeah, on that E66, off one bridge. Is that why it's not going all the way to 21?
Like, 200, 300 feet from Highway 21. It's like the county line.
See your things. Go to the west.
Yeah. Property.
Are we gonna do something with from the bridge to the county line then, or no?
It's already concrete, right? It's concrete, yeah. So we over the south of that with asphalt.
And you typically don't pave over a bridge, correct?
Yeah. No. I mean, unless some bridges, yeah, they already worked that into the.
Well, the piece after the bridge is pretty well shot too, that's why that. Up there.
I just got two thank yous, so thank you for getting rocked down by Liquid Grow there in Traer. Got a text from someone pretty quickly, you guys got that done, it was a pretty big drop off, so thank you for that. And then it sounds like the rock you're getting from Garrison, it looks pretty good. It used to be the old kind of brown, would just fall apart and crumble, and they said it's white. It looks pretty good, so thank you for the work there with your team. Have fun.
Have a great one.
Okay, let's see, discussion possible action to donate used sheriff Durango to Tama EMS. Casey asked us to put this on the agenda. You want to speak to it or just want us to?
Yeah, so we have a Durango, old Durango that. Obviously, it's not karaoke time. The old Durango that has, I believe, roughly 120 some thousand miles on it. We were approached by Tama EMS to take a look at it. It sounds like they are in the process of figuring out some sort of a fast attack paramedic type vehicle that I think Unity Point utilizes the same type of service. This is to eliminate or hopefully eliminate the time needed for critical care with a paramedic in certain medical events. In doing my little bit of research that I have and what the national average for an auction on that Durango, I think we would be lucky at an auction to get a couple $1,000s out of it. So in discussing what we would like to do with that, the option of donating it to Tama EMS came up, and that's kind of where we're at with it right now. I don't think it would be a bad idea. They're gonna try this program and having a fast attack type paramedic. It has a lot of equipment that we use and have used in our squad vehicles for emergency lights and all that. We have donated quite a few old, out of date for the technology that we use, I should say. We donate a lot of light bars, a lot of LED lights, the fire departments and whatnot, so it was brought up again, donating that to Durango to see if they can implement a program, and that program, if it's successful, it sounds like they will then upgrade to a newer, nicer vehicle. I just don't, with that many miles on it, I'm not entirely sure what shape, how long it will last. So that was another factor in mentioning and bringing up the idea of donating, so.
Like the motion that we can donate. Such that would say.
Okay, it's been moved.
I'll second.
Been seconded, discussion.
Okay, some of the older than us. Having done CPR on a neighbor, years ago, I think this is a very good option because the faster we can get a true paramedic to a site. And I understand why it would make more sense than waiting for everybody to show up to the ambulance and run out. So to me, it makes sense. It's a proof of concept. And I'm big on proof of concepts. I'm talking on one right now. So once we've proven this is going to work, we're gonna ask the county to pay for it and put in microphone so you guys can hear it. So I am all for this.
Any other discussion?
Here's that vehicle.
I knew somebody was gonna ask.
And what do you mean?
I think it's a 2020. 2020 Durango. This doesn't happen. We usually don't. We have a lot of people that ask to purchase them, inquire about them. This is the first time that I can remember that any EMS fire department has actually asked or requested to look at a used patrol vehicle. Usually it is, like I said, for some of the equipment that is in the vehicle, not the vehicle itself. So in talking with Tama EMS and obviously and what the response times are, I don't want to set precedent that this is what we're going to be doing every time with our squad vehicles. However, this is the first time that this has been brought up, and just in the discussion with Jimmy down at Tama EMS, I think it would be more beneficial at this point to donate it and then see how that program goes and kind of go from there.
I had a quick question for you, Casey. Have you ran this by a grant? For legality, the only thing I know that just for the disposal of county property, I think they have two options. If it's a vehicle, to donate it or trade, or not donate it, sell it and put the proceeds back into the general fund or charitable plan, or to trade it. I tried to find some language. I sent an email off to Brent, but I just never heard back from him.
So I was going to talk to Brent about that, but it was a busy week for him and for me. I did look at the state of Iowa's policy and procedure on their old vehicles, and they have the, in the code, they do have the option to donate to a nonprofit. I also looked at Johnson counties, and they do the same thing, but they have that option to donate. So I did not see that in ours because I don't think we have anything for vehicles and used vehicles. Usually we send them to consignment auctions, but just in the brief, looking through Johnson County's policy and the state of Iowa's policy and the code, it appears that it belongs to the nonprofit. There's nothing wrong with it, but I'll wait for response from Brent as well to make sure that it's 100% kosher.
Okay, that was my only question. The only thing I could find is like, you become the owner of abandoned vehicles, and then it says what you can do with them. You can donate them for sure. this was being taxpayer money that was used to purchase it. And, as long as it's going to be used for kind of all the county, I think it's.
But I don't think you can just donate to anybody.
Right.
You have to donate to certain nonprofits or other governmental agencies.
Yep.
So do you want me to withdraw and table until we talk to Brent?
What do you wanna do?
I think if, until we're sure, remember, we talked about everything being transparent and legal, I'll withdraw it and request we table it until he said that's. This.
So there's a motion to table.
Second.
But moved and seconded to table until we can talk to Brent. For discussion. All those in favor say aye.
Aye.
Motion carries. We'll table it. We'll bring it back next week. Discussion, possible action. To approve all county departments to use Tyler time clock system for payroll. This was asked, a couple of things. One, we're going to be, transferring the payroll from the secondary roads department, as we'll have somebody who's going to be retiring at some point. And so we're going to migrate their payroll system over to the auditor's office. So shall we do all their payroll stuff? And so it was asked that we would take some kind of action from this board, just to support their decision. There was some software that was purchased. It was fairly expensive a year ago-ish. And, it's not being implemented, it's not being used. And, so that was the intention was to get people to start using that. I guess I'll just open it up if anybody wants to make it before we take a motion and however you want to do it.
Ms. Bowman. I'm Leanna Kriegel. I'm a clinical manager over at Tatum County Public Health and Home Care. This time clock system does not work for us. It is not in regulation with CMS. It doesn't follow what we need to have. Right now, your validation, everything you're cheating, goes to a different coding, which tells them who gets paid. Medicare, does this come from Medicare? Does this come from Medicaid? Does this come from private pay? Does this come from the VA? Does this come from the settlement? So all of our different payments, due to all of our different revenue sources that we have coming in, we have to code. So in order for us to use this system, we would be timing in and out on our personal cell phones every 15 minutes, as well as then going back to the office and still continuing to write everything down on a piece of paper so they know where to put our time at.
Okay.
So I just kind of want you guys to take that into consideration, that would be double the amount of paperwork for us. What we're looking at, it would definitely be a major impact for us over here.
Speak on that to say you wouldn't be clocking in and out every 15 minutes, because for payroll, you would clock in when you started your day, clock out when you ended your day. For all that other stuff is within your department. If I don't track any of that, we can try to do their tracking of that stuff. It's all be you're getting paid. So it would be when you started your day and ended your day. The rest of your day sheets, that would continue to track the stuff you need for your department. You wouldn't clock in and out every time you change the job, because that's not how it's done now. You just report the hours you work. That's how you get paid.
So we still time in and out on your clock system, and then we still time in and out on our own clock system as well. And then
That-
for
that-
15 minutes or 30 minutes, we time in and out.
But
Plus, we also
you're
have-
already
plus
doing
we also
that
have
apparently
uses
on
for Medicaid.
But that's what you're doing on your end. I don't need to know any of that. I just need to know when you started your day and when you ended your day. That's how you get paid.
That's more.
I'm Kelly Parker. I'm also a registered nurse over at the county. Does that count as well as for all the call hours that we work? Because we are on call, every one of us, 24 hours a day, 7 days a week, we trade off. And if we get a phone call as, say, 4 o'clock on a Saturday afternoon and one of our residents has spilled their med planner and there's meds all over the place, we go out and we correct, we fix those things. Or the are on the phone call, sometimes taking referrals from hospitals to generate revenue and get admissions over the weekend. So, which we have no control of when those calls come in from the hospitals. They call us, we take the referrals.
That's just like
So
the
did we do the
deputies.
same thing?
The
How do
deputies
we
do the
clock
same.
right now for those?
Did the same thing, you just clock in, clock out when you're done.
There's a way to do that from home?
I get personal cell phone,
Okay.
that we don't get reimbursed for.
I don't, cause I don't have my email or anything on my private phone. So I choose not to get reimbursed. On countries. I need that option.
Would the county be providing county cell phones for people? Because I'm another person, I will not put county work on my private phone because I feel it will put up to the county. And I will not, actually, I don't put much of anything on my phone, period, but. And I'd also like to say that the first system that we had was great. I mean, that was pretty smooth, it worked well. This new stuff, I hate to say it, I'm not trying to be mean, but it is horrible to work with. We did try it in our office. It takes so much longer to use it. It's very confusing. There's nothing easy about it. And I don't feel like I need to spend a whole day or more devoted to payroll. I am not Tama County payroll specialist.
What was the other system that we used?
The first Tyler version,
Okay, that was better.
uh,
That was better.
much better. It was very slick, very easy to use. Didn't take long at all.
I think to clarify. She's speaking more on she's the one that does the payroll, and I know that it takes a very long time to get that done. This new system, and so that was, my question is, this is the newer Tyler system and not the older Tyler system, the one that we were testing, the punching in with the phone.
There were problems when we started on the system. Most of them have been worked out, but it's been hard to tell because nobody's been using it. Once implemented and working properly would actually make it much easier on Kyra because it literally would. I mean, I'm doing basically what Kyra would be doing. And there are 2 deputies that have all along clocked in and out. They've got it figured out. It works smooth. I rarely have to make any adjustments from the paper timesheet they turn in to what they've clocked in and out. It's seamless. And once everybody's using it and utilizing it properly, it's better tracking for hours that people are working. It's better tracking for anything we have to report on, be it work comp, unemployment, anything where we need to run a report is gonna be much more accurate. And that might be, but I just don't feel like the need is on me or anybody else that's using this to devote that much of their time when that's not their job title. If everybody were clocking in and out, it wouldn't be what it looked like for you before. We did try, I mean, I'm not going into this blindly, we did try the system and it was not very good when we tried.
Just for my understanding, how long ago did we try and how many people, or did each department? How did that go last time, I guess?
Getting people to try was, I had, 911, pretty much their whole department voluntarily tested it. They had it running very smoothly, which is why I say it is doable, because they would have been just like the sheriff's office 24/7. I do understand the sheriff, there is a difference in the fact that, you know, they can get call and they're headed out. But like I said, I've had 2 deputies doing it all along. It's been working perfectly with them. It's not like, and I even told Casey, if somebody gets a call and they take off and they didn't, you know, clock in, obviously for them, it's very easy because they called it when they went out. He's got a true record. And it's not impossible to just enter something in if somebody forgot a clock in or a clock out. And I'm more than willing to help everybody through the transition. But it goes back to this, it was a very expensive system that realistically was all approved prior to it being determined we were going to use ARPA funds to purchase it. And then once we did that purchase and we were locked into this amount of money, then all of a sudden everybody says, oh, it won't work for me. But yet, yes, we promised we would implement. There are a whole lot of issues with that. We've been now using it for a year. Most of those have worked out. I can't guarantee all of them because like I said, a lot of people aren't using it. So it's kind of hard to see what problems might still exist. And when everybody quit using it, then we were unable to get the free support we had when we purchased it. So now anything's gonna cost more if we can't work it out ourselves. I've learned a lot about the system. I've worked on it, a lot. I put a lot of hours in trying to make sure it works because this is what was determined we were going to do. It was said by multiple people in various departments that we needed better tracking of what the employees are doing. I mean, it goes back to the taxpayer money that we're spending. I think as a taxpayer myself, I want to know that we're not paying people that aren't working. And I have heard rumors that that happens, that we have people abusing the system. Obviously, I don't think that's a majority, but one person abusing it is wrong. I've never worked anywhere that I can talk about my job. So I don't really understand pushback. To me, if you don't want to clock in and out for your job, then I'm sorry, but then you're hiding something. I don't have a problem clocking in and out. I've always had to clock in and out. I don't understand why it's such an issue. I've had people in almost every department try it. And the hardest department, quite honestly, that we've had has been roads. And we've been working with and talking with Ben, trying to see what we can make happen or not happen.
I think the last time we talked about this was.
Right, but I mean, we had,
We're jumping quite a bit ahead to where, we're just kind of, are gonna do this now. If with the way you talked about doing it is where we're clocking in and clocking out on their cell phones. I know, the union. And think that that's where we're trying to figure out how we go about that is the issue. Because I know, that's gonna be one of the major pushbacks, and then they'll see that our supervisors all got county issued cell phones. And they'll be like, well, we're having to use our personal cell phones to, for the county.
Do they use their cell phones now when they talk between each other?
They do.
Yeah, they do.
I mean, it's one of those things, so, I just see it as, well, it's just clogging in, yeah, almost currently, so and then the issue with, like changing jobs, I guess, and I was told that there wouldn't be any geo fencing possibly, is
that would kind of be up to department heads, in my opinion. If you feel like your employees need geo-fenced or not.
it's kind of, since our time's underground, shed locations now, I feel like that would kind of make no sense to not have, I guess, geo fencing.
I think with secondary roads though, you have to, if a guy's gonna go do this and then he's gonna go push, run a maintainer and then he switches to this, he'd have to actually switch, and that's part of this payroll topic,
Yeah,
correct?
yes.
Yeah.
So.
Yep.
We're just, looking at. See what they've done.
And that is one that's still negotiable. Also, that was something that we were hoping to be able to help you in the tracking, but if it is too cumbersome, obviously, if you don't want your guys switching jobs throughout the day because you feel like it's not practical for them, that doesn't have to be done. That was just something we were trying to see if we could make work, because we know you have to report all of that, and if it would make it easier on your end to get your reporting out by having that switch. We wanted to see if we could make that happen for you, but it's definitely not a required that you would have to have us doing that.
Just, different cell phone reception areas, probably. If they're down in the hollow of somewhere, they're not gonna get any. So they'd have to drive somewhere to make sure that they got one coming in the next job.
Can I just ask one more question on so the weekend time, is there a way for that to work for our agency where, as you said, you clock in and out, and that's understood when you start, when you stop? So at the end of our day, if we're on call, we don't clock out.
You
But
actually have a,
then if we get a phone call or we have to go out or something happens, we get a different pay rate. We have to clock in for that increment of time, whether it's 15, in 15-minute sections. So how do we, in that system, clock in again to get the appropriate comp pay? And
So
show
you're-
what we're doing during that time frame if we're already clocked in? Is that system set up to do that?
we would have to talk about that more, because I guess I'm not following exactly. I mean, Jolene right now is entering all of your guys' hours to make it work anyway. And like your on-call hours, like when you leave for the weekend, if you're on call, there's a couple days to put that on call and in the dollar.
Yeah.
And then, I guess I wasn't under the understanding, if you get called out, different rate than.
Correct. We get time and a half.
And we have
Overtime.
practice on call. Oh, well, time and a half overtime, yeah, that.
We have to
that's what I'm-
clock in on our day sheet, the weekend, we have to write that in and keep track of that, of course.
And we have a county phone that we have to carry with us, and we have trackers on our vehicles. The county knows where we are all the time. They know when we come and go, they know when we get our phone calls coming in, but the biggest thing is the extra amount of time. So somebody calls me and I say, oh, I'm sorry, just a second, let me put you on hold, so I can call the county now and clock in before I help you with your dilemma. Or are you having a heart attack, maybe you should dial 911. Do you see what I'm saying? When we're on call, that is not, we need more discussion on it, more education about the system and how it would work. And that's fine, but I mean, I would like to work with everybody on how it works and how it would work. But the problem is I haven't had anybody willing to work with me. And like I said, it's not just me, that's almost doesn't happen. I put a lot of time into it myself, and then everybody just said, nope, I'm not doing it. Right. And I look at that money could have been used for something else if we weren't going to use the time people. I'm not blaming any employees. I'm just saying this was a huge project taken on, and now all of a sudden we're ditching it. And that was a lot of money that could have went towards something else. And then, so I just hate to see us just throw away this entire program that county used money to purchase. And the only reason why we brought it up is because it says discussion or possible action. So we wanted to make sure, at least for our department, that there needs to be more discussion on this. We need to know if it would work for us or not. Obviously, the roads and everybody else is the same. So. And I understand that, but my point being, we went this route because I've tried talking to all departments and nobody wants to talk. And I'm not saying we were employees, I'm just talking department wise. Correct.
Just for the record, no. I don't have any idea how this works or anything, but we had 2 department head meetings and twice it was set to haul it. Nobody got the okay to buy this.
That is incorrect.
No, I was there.
Then how did ARPA funds get approved for it, Kurt?
I don't know, we voted that in.
Because first it had to pass the ARPA committee, and then it had to be approved by the
We
board.
had 2 department head meetings at the office, and both times it's like, hey, we don't know exactly what's going on. Road department had some issues.
This was before Ben, it was all approved.
No, Ben was involved with this.
No, this program was approved before Ben was ever hired. So we're going way back, you're talking
No.
later. There
Oh,
was,
and it was later that we were gonna halt it. Am I
but it
correct,
had
Ben?
already been purchased.
Purchase already being there.
Okay, so we're just gonna halt the implementation. Okay, all right.
And I would mention, as a clarification, in 911, Jeremy was entering their times, all of them.
Not originally, no.
He was for the last quite a.
Yes, I know at the end he was, but originally they were all
Maybe
clocking
like
in and
a
out.
few, a month or so maybe, but Jeremy, from what I understood, had been doing it for.
I worked very closely with them. They clocked in for quite a while.
I just know with, Tyler was very busy as it is. And a lot of times it was a lot of Mondays going into Tuesdays, if not longer, just trying to figure out the whole system, and it was a challenge.
Anybody else?
So we have one department in here, yes, one or two people in each of your departments be interested in trying it again. Like let's not do it, like across the board is never a wise idea because that could lead to a lot of issues, in my opinion. I mean, is it something that one or two people would just test it, where you do a paper and it just, that way we could have some fresh feedback for this group to know, and everybody, like, who's it gonna work for, who's it not, and maybe separate boards, if they have their own board, that might change where we suggest, but their board still does what they want to do, you know?
With the newer updated system?
Yeah, like if one or two would be voluntary, say, hey, I wanna try this, I'll keep track both ways, Michelle can go sit with department heads, make sure, you know, questions can be answered. If we spent the money, let's at least try it out again, one or two is my opinion, but I'm okay with not doing it across the board. Initially, you know, let's make sure is it gonna work, and who's it not gonna work for, and why? So, it's just my thought.
I like to talk kind of what we.
Test anyway.
Just because I want to make sure that,
Yeah,
like I said, she already does enough. I don't want to add to it. If we need to discuss and figure out a different option, then we can do that, but I'd like to have that discussion with my staff first before we
okay,
make a final decision. Cause I mean, it's hard for us because we're tracked no different than public health. I mean, we have, every time we go in service, it's logged. Every time we go out of service, it's logged. Every time you put on a call, it's logged. So it's, sometimes it seems like things are just redundant that don't need to be, but.
yeah.
Yeah.
Yeah, and it's good to understand all that, you know, I think each department let us know feedback, and I think Michelle's trying to make it better, you know, like a lot of systems, like even my kids' daycare, you know, it all made to know payroll personnel. Oh, and like, it could be work to make it easier on you guys, that's what we're looking to do, if it's, you know, and there may be pain points at first, but sometimes it's always a pain point, and then, oh yeah, this isn't so bad, it can make my job easier, so yeah.
Well, you already have a couple deputies doing it. There wouldn't be nothing different for them. Would you, conservation's here, would you guys care to put a couple guys or people on it and try it?
You guys want to see what? We probably need to put somebody that's gonna
Board of Health.
change jobs a little bit more.
You guys gonna take care of it?
You would have to speak for Johnson.
Yeah, when we'll see her or later today.
Good, dude.
I agree with Heather said, we can't determine what the problem is or are if we don't test it. So I am all for testing it with at least a couple of people in each department to make sure that we find out what the problems are and our solutions and our easy solutions. So the problem, because I think particularly for you, Ben, when it comes to budgets, knowing what your guys and gals are doing makes a big difference. For you guys, I had to clock in every time I did anything, so I think we should test it. At least two or more, in each department, so we can find out what the problems really are. And then go from there.
Good. My main concerns are just any countywide personnel policy. I did pull off some case law, that doesn't support supervisors mandating policies for other departments that are underneath elected heads, or governed by independent boards. If we're going to have a countywide policy, the best way to do that is to get and make sure that their needs are addressed and their concerns are addressed. We can, you know, right now, pass all and say, everybody must do it. It's pretty big horse and but if we could get people to try it, like Heather says, I think that we could have a department head meeting, maybe get the feedback of the department heads and the other employees, maybe funnel through their supervisors and say, that's something that we really want to do. We did, spend the money and to try to make that, work for everybody. And maybe it's not gonna work for every department. I think that there are some departments hopefully that we can make it work for. I do understand we don't wanna make more work for Kyra, but we also don't wanna make more work for Michelle. The way that these systems have worked for other places I've worked is that you clock in, and then it goes to your supervisor, and so when this goes directly to payroll, goes to supervisor to approve, and then that gets sent off after your supervisor approves it. If you need changes in your time card, you can make a manual change to your time card. So I think there's hesitation on it. And I think that it's a pretty good thing, easier for timekeeping, it's easier for doing payroll, if everybody is doing their part instead of just kind of laying it at the feet of one person. So I understand both sides, but I do understand that it's probably better if we try to get everybody on board, try to get some buy-in from the departments, address your concerns and move forward from there. But not opposed to taking a motion or whatever we want to do.
Motion for what?
Yeah, I think we just waited.
Do we
this
wanna
point.
table it and then get together with them? And I think a trial period would be a kosher thing to do too. I mean, you guys are already doing it apparently, two guys or a couple, but
Well, it's been so back and forth.
yeah,
Use it, then not use it, use it, then not use it.
alright.
Some guys just were law enforcement in general, very routine based, so once you get a routine, just do it. I had a very difficult time logging in and out because it was not part of the routine. But that's me.
You're in charge.
I'm charged now, so.
You're like,
Would it be more helpful to have people from each department or one department?
It would be great if a few people from each department would try it. That way we can find out where problems are and we can work on them. Because to be real, right now, it's a mess at payroll. I mean, I'm getting timesheets in so many different ways that when I send them out, like this last week, I barely got enough time to get it paid. I mean, it's getting more difficult all the time. Sorry, I get a little emotional too, because I feel like everybody's against me and I'm just trying to do my job too.
I think a trial period would be good. I mean, to get everybody on board. What can it hurt? If it's hurt, it sucks, it's terrible, you get a trial period. But do we table this?
we can't tell them to do a trial period though, correct?
No, we could ask them to.
That's what I'm saying. You want a motion for that or just a table, I guess, would be the question.
It's whatever you guys want to do. Heard the discussion. If there's a motion, we could make a motion. If not,
Guess I'll make a motion to table it, let further discussions be held and department heads to work on this topic.
I'll second it.
been moved and seconded. So whatever Heather just said,
Yep.
any discussion? All those in favor say aye. Oops, going to motion carries.
You know, any discussion?
That was good discussion. That's all right.
Oh, I'm sorry.
That's all right.
What do we have next? I have
Hiring freeze.
hiring freeze exemptions. I don't think we have anything. No. Did you submit one? I got an email, I thought.
I just
The
read that.
conservation officer.
Yeah, you guys heard one last week.
Yeah.
So let's see.
It's
I don't think I've seen it.
We have a ranger vacancy right now, but we're still in discussion of how that role is going, if it's gonna work at all.
Okay,
Before we bring it forward, kind of posting basically, if that makes sense.
okay.
We can't hear him though.
Yes, Ranger posting that they're going to see a process something different and then bring it to our attention. Just from my understanding, our board, we don't approve independent board. If you have the money, you hire them. If you don't, you don't. For your independent board, it's kind of the countywide policy. If you have your own independent board, we don't make decisions on hiring. We just make decisions on if we fund, how much we fund. Beginning. Okay. All right, next will be Aflac. Representative to give presentation on services offer.
Hi, my name is Jake. This is Diana. Should be helping me today. I'm gonna hand off, so be careful as wires there. Gotcha.
We can pass them down too, if it's easier to.
What you passed it on.
Thank you.
There's a couple extra there. I wasn't sure exactly how many.
I get it back. Just more.
Nice yours there. Okay.
We're good? If we're good, so.
Is everybody familiar with that flag? All right. Yes, yes, ma'am.
I am.
Okay, good. So, just kind of recap how we got to this point. I had stopped out, to one of the departments. And there was some interest there in bringing Aflac in for, their crew. They put us on the agenda for the board where we came in and, presented at an evening board and also to the crew. Everybody there was interested in at least one of the plant groups. So we get to this point, I know I talked to Kurt and Kurt, pointed me in the direction and, yeah, we got on the agenda today and I will let Diana run through the plans that we're presenting.
Okay, thank you.
So, I'm guessing you're all familiar with Aflac. Seen a duck on TV or something maybe? Yeah. So we're gonna just say right out of the gate, we are not your major medical. We're here to help beef up what you are offering as far as your county benefit package, not to take away from it. We don't pay doctors, we don't pay hospitals, we pay policyholders because Aflac believes that if you got medical bills coming in, chances are you probably got some bills at home that still need to be paid, right? So you have three doctors. The first one is a cancer policy. I don't know if you guys have seen the stats, but Aflac is number 2 in cancer diagnoses right now, right behind Kentucky. I came to Aflac by way of cancer. I was a policyholder first. Aflac lays out exactly what it is that they're going to pay you should you have a cancer diagnosis. And before I say that, I'm going to tell everybody in this room, if you're not doing it already, get your cancer screenings on an annual basis. Make sure that you're taking care of you first. But it starts at your screening. There is a benefit for that. And then as someone is diagnosed, and it pays a lot more if it's a child. And unfortunately, cancer knows no boundaries. So, and then on review treatment, every step of the way, there are benefits, up to and including hospice, if that's how far your journey takes you. And you can look through this and you can see exactly what they pay. I will tell you one story about a 13-year-old with a tumor. He had a brain tumor. At the end of his journey, Aflac had paid out over $90,000 to him and his family. What his dad said to us is, at no point did Mom and I have to decide who was going to those doctor appointments. We got to go together. And I think that that's a pretty powerful story to tell. He is cancer-free today. That's why I tell that story. Right behind that is an accident policy specific to accidents. If I had a heart attack, this isn't going to pay me a dime. I'm just going to say that right out of the gate. Works the same way. Aflac's already predetermined what it is that they're going to pay. On this one, there is also a $90 one-time per household per year wellness benefit. And Aflac defines an accident as an injury that occurs while not under the influence, wasn't intentional, and I saw a doctor. It's pretty much that simple. And it doesn't matter how big or how small it is. The more intense, obviously, the more the benefit will pay. Do you guys have any questions yet?
I do not.
All right. So behind that one is a teal colored. This is a rider that goes along with the accident policy if you're interested in it. This one is a lump sum payout. And basically what it says is we're going to pay you X amount of dollars based on what category of illness you were diagnosed with. Does pay as much as that ability, but it is there to help with some of those illnesses that you might have. The last one in there is critical illness. I do have a tie to Tama County in that I graduated from Geyser Geneseo many years ago. Shouldn't tell me. But any of you that were county workers several years ago and might know Mike Meek, he is my family. And this is the one I bring it in because I know that Michael would have benefited from this. When Mike had his stroke, this policy would have paid him $35,000. Or I'm sorry, $25,000 for that stroke that he had. Plus some rehab, plus the hospitalization that he would have had, so that he did have. But this one is for critical illnesses, so heart attack, strokes, somebody who gets third-degree burns or needs to have an organ transplant, all of those fall under critical care. And then also in your packet is how much does it cost? What we're asking from you is not money. We're asking for the opportunity to meet with your employees and to have this run through payroll. Everything I just talked about is pre-taxed. And we would be more than happy to work with whoever is doing your payroll. I know there's somebody over on that side. To help get it set up if they need to. And at that point, I don't know what our next steps are. We just kind of been going through channels and following our guidance. Let's talk about claims for just a second. Claims, so Jake here is new. But he's the one that made the approach. He's also the one that will be working with your folks to do claims. We don't say call an 800 number and file your claim. Guy right here will be hand in hand the entire course. Any questions that we can answer?
Everybody's aware this comes out of the employee's pay.
Yeah.
The county doesn't.
Right, through payroll.
Right, just so you guys know. No cost to the county all of these benefits would be available to them. Your main question is if we can put it on the payroll. And if there's a claim with Jake, not from State Farm, perhaps later.
State Farm, but we work with them at Aflac.
We're gonna do some commercials.
And so, can't take action on it, I think, just because we have a presentation, we would have to put on a future agenda, to take action on it, just because of the way that it's worded. I don't see any issue with it, I don't see any opposition necessarily to it, because not necessarily. I think if,
I think it's something we need to have discussion on more, just for the fact that we don't have to be offering too many services. I do feel like it would be important to find out how many employees might actually have an interest
that's what.
before we would say yes or no. We can't add every insurance that one or two employees do. I mean, realistically, that becomes a nightmare, trying to manage.
What if they clocked in?
That's a joke, just a joke.
Speaking to that for just a second. So, I have been to Tama County multiple times and I was told, you need to find 3 people that are interested,
It was usually 5.
but they told me 3. But anyway, it doesn't matter. And I feel like we've done that now. So, and I get what you're saying, absolutely. I just want you to be aware that we're trying to jump through every single hoop that we've been asked to jump through.
I think the next step was just, I said, have a meeting.
Present
With
the
the-
department heads to see how many is interested in their, well,
Just have, please, for
Sam and Pastor Black sat up at the bank room and did a meeting. And at that time, might have been before your time, I don't know how long you've worked for them. They were unable to get the 5 people that the board at that time required to sign on. They just wouldn't, they didn't get the numbers. Like I said, it's just a matter of, I think it's something that as a whole, we need to determine what we're going to be doing for offerings. I know, everything that, Aflac offers, we already offer through different providers. Not saying they're better or not better, just to be open on, you know, it comes down to, I think it's a discussion that needs to be had as to what the policy really will be, how we add new providers or don't add, or what we're gonna do. I mean, obviously, whatever the board decides, we'll make it happen. It's just gets to be cumbersome if you have, 10 people offering first. You want to pay them each. It just becomes a lot. So I mean, it's just something to.
I honestly don't see there's a problem with at least having a meeting. Ben, could we have that at the office?
Yeah.
I mean, just,
We could do department meetings, like that's easier.
Yeah.
Do you do department meetings? Or we could
Department head
come to a
meetings?
Department meeting and present and see if there's interest.
well, that would just be with the department heads, and then they'd have to go back and talk to they'd have to have meetings with their individual departments.
Thanks for what she's saying, each,
Each department.
Oh.
the department has.
Yeah, present it to your people and see who's interested.
So the one discussion item I had is, have we taken this and looked at our current insurance plan to see if it is covering it all, how much what's the cost difference? I don't know the answer to that question, so.
From my conversation with the people I spoke with, the supplemental side, like a cancer and an accident, was not covered. We are not limited to these, but this is what we chose to bring in because of what you currently offer. And I may be mistaken, but that's just the information I was given.
Yeah, I agree with David. I mean, Michelle, you said there might be some that we already have, so I think
We already offer
internally, we need to figure
like
out.
that. Employees may not know either, because the sad part on how it's handled at county level, we don't offer a cafeteria plan. So it's not necessarily that employees, if they don't go to open enrollment, they very well don't know what we offer. Because we don't actually lay it out and say, here's all the offerings, when, I mean, I've been doing that now with the new hires I've done, but, my thing with Jim, can I have the cafeteria plan versus, yes, you can do a payroll deduction, and from the time I started here, they've always offered payroll deductions, but not a cafeteria plan. So it wasn't like you could go through and say, yes, I want this, yes, I want that. It was more employees coming in and saying, hey, we offer this. And then we say, oh yeah, we have a provider if you want to go through that. And so that's where I will say it's kind of messy and maybe something that needs looked at, but I don't know if it's a county thing that you can't do a policy on. Or I don't know the rules. I don't know why it was ever done the way it was done. I just know in the past, they always said unless they had 5 employees that wanted to do it, we wouldn't do it. Realistic, even 5 employees is pretty low. You could still end up with 10 different policies offering the same thing. But like I said, I don't know the rules, the laws, if we're allowed to just say we're gonna offer Aflac, we're not gonna offer anything else, we're only offering. I don't know. So it'd be something maybe we need to look into as well as having the
When you guys make the decision, I guys are just having the conversation, so I thought you guys would like to know. Yes.
Yes, we do have another company here that wants to present too, so.
Yep. Okay, so more to come. Thank you guys,
Thank you.
Thank you. Thanks, good.
And.
Okay, I'm great with it.
So, hello, everyone. My name is Michelle Oliver. I am with Liberty National. I don't know if any of you guys have heard of us, new board members. We have presented to you guys in the past. So just bringing this back up for you guys. So, tell you guys a little bit about Liberty National. So we have been serving working Americans since 1900 from our local facilities across the nation. So our local facility here in the state of Iowa is based in West Des Moines. However, I'm from Iowa Falls, Hardin County, so I would be your guys' local supervising agent here for the county of Tama. What that means for you guys is that you never call a 1-800 number or our home office. You have my personal cell phone number that my family has. So if you have any questions or claims, you're going to call me right away. And I'm going to walk through that process with you. In addition, the Globe Life Company has more policyholders than any other life insurance company in the nation. And because of that, we have earned top financial strength ratings from the AM Best and the Better Business Bureau. We always ask everybody, do you guys happen to be a sports fan? All right, well, I'm not seeing any go Dallas Cowboys.
Rain.
What?
Here we go.
Yes.
Here. All right. Your season. I'm a Nebraska Husker fan, so I already
Same.
know.
My husband's from Nebraska.
Oh, right. So we've been horrible for 20 years. So it's just that's been
Just roll with it.
Yeah, absolutely.
Dallas Cowboys in Nebraska. Meeting's over.
Right. I guess I gotta walk out. So what this means for you guys that we work with our sporting sponsorships is that we don't do any overhead advertising, allowing to us to offer our policies about the fourth of the cost of our competitors. So you can see here, we do sponsor the Dallas Cowboys. They only have 10 sponsorships, so we do hold one of them. We also work with the Texas Rangers. Sometimes people do recognize that because they won the World Series there. And then we just recently signed with the LA Lakers and Atlanta Braves for those sporting sponsorships. So just kind of getting our name out there with that. So what we're going to provide for you guys at no cost to the county is provide valuable benefits to your employees, their families, and I'm also going to help them save valuable money on tax dollars through that payroll deduction. So how we're going to be a little bit different than our competitors is that we have a unique life product that is exclusive to Liberty National and can only be offered through our program. In addition, I'm always going to go off a needs-based approach. So I'm going to ask them questions about things they already have in place and maybe some gaps that they have. So if they already have an Aflac cancer plan in place, I have an Aflac cancer plan. It's amazing. It's wonderful. I definitely do not want you to cancel that. Let's see how much it would cost you to add ours on. Or if you don't want it, that's totally fine. In addition, everybody who sits down with us is going to receive 2 free offers. So accidental injury is the 3rd leading cause of death in the United States. So Liberty National is going to provide each one of your employees with an accidental death coverage of $3,000. It's all trickled down to their spouse and children as well. I know as a previous funeral director, this $3,000 does not cover your expenses. However, I'm going to get this paid out to you within 2 weeks so you can continue paying that mortgage, so you can pay that car payment, whatever you need to do to continue moving forward in your life. In addition, you're going to receive a no-cost discount card that's going to give you access to a national network of providers, anywhere from 10 to 85% off of vision, hearing, prescription drugs, chiropractic care. It is specified to your location, but it can be used nationwide. I always just recommend everybody take it in to your doctor's appointment with you, show them that you have that card. They'll let you know what kind of discount that you do have with that. So a lot of times the companies that don't have insurance, this is really something that we gear on for them because the chiropractor and vision are really high bonus points there. So like I talked about, we go off a needs-based approach. So if you put on the cap of your average employee or your guy working on the roads, you know, if they were to suffer from an accident, get diagnosed with cancer, or even pass away, do they or their family have enough to pay those final expenses, to replace that income, to continue paying that mortgage? Because we know, like she talked about, you know, we're probably going to have to deal with cancer or critical illness within our working lives. So, you know, it's just talking about some of those kinds of things with them, sitting down and offer policies that help fill those needs. Now, we don't have a quota here. I know that you guys like to have a quota here, but we can give everybody the 2 free policies, and if nobody else wants policies, that's fine as well too. So back to our unique life product. Does anybody know the difference? Does everybody here know the difference between whole life and term life? Okay, beautiful. So what we are is like that combo in the middle. This is our bread and butter. This is what we really like to talk about. So we have a group term life that gives you comfort up until age 100, but you have the option to be paid out at 65. What makes our program so unique and beautiful is that it's completely portable. So if or whenever your employee leaves the county, they get to take this life insurance with them, with their premium and benefit never changing. If they're 25 today, they're signing up for a 25-year-old rate, they're going to pay that 25-year-old rate until they're 65. It is never going to change. We ask 8 simple health questions to get them approved. We don't do any mouth swabs, blood draws, anything like that. Like I said, it's just the 8 simple health questions. And then this is where the tax savings comes into play. So the first $50,000 of life insurance, according to the IRS, is only on a pre-tax basis. Any questions on the life insurance? Beautiful. So then we also have some living supplement plans that we have, and our first one is our cancer policy, and it does say here that 1 in 3 people will be diagnosed with cancer in the United States. Here in the state of Iowa, it is 1 in 2, and we are number 1 in the country, right behind Kentucky. Absolutely. So, and it does say that it's on the rise. So like I said before, we're definitely going to have to deal with this within our working lives. So this cancer policy has scheduled benefits with no lifetime maximum. So I'll explain to you guys how that works. So once you receive a diagnosis of cancer, I'm going to send you a first occurrence benefit of $3,500. Now that $3,500 is designed to help knock out those healthcare deductibles, so your healthcare is kicking in all the way. However, just like Aflac, we pay directly to the insured, so you can honestly use it for whatever you see fit. In addition, we pay up to $500 a day for chemotherapy and radiation. I'm going to have you, doesn't matter if you need 30 treatments or 330 treatments, we are going to be there every single time for you. We're not going to say, okay, you spent $300,000 on this policy, now you're capped out on it. In addition, if you have cancer and it goes away, the chemotherapy and radiation work, let's go. All right, we're going to celebrate, but if it comes back, we're going to pick up right where we left off with this policy. We're not going to give you that first occurrence again, but everything else we're going to pay out on. The hospital confinement, we also pay for 90 days you're in the hospital, and then $250 a day, 180, which will be up to $600 a day. Transportation, we pay for you and a loved one to fly to any cancer treatment center of your choosing 6 times a year. Otherwise, we do pay 25 cents a mile. We also do pay $10,000 a year for prescription drugs. We don't limit you to certain kind of cancers with certain kind of drugs or milligrams. Whatever your doctor is prescribing you for your cancer fighting treatment, that's what we are going to pay for. This, like I said, has listed about 18 different payouts within the program. This for a 40-year-old individual would cost them $4.61 a week. Just to kind of give you a price there. Any questions on that one? All right, beautiful. So we also have critical illness, and every 40 seconds, somebody is having a heart attack or stroke, and heart disease is the #1 killer worldwide. So again, we are probably going to have to deal with this in our working lives, and more than likely, we are going to be able to come back to work. So how do we protect our financial stability while we are dealing with these? So this cash cancer program or critical illness cash cancer program is a beautiful program. So we define critical illness as stroke, heart attack, kidney failure, organ transplant, total loss of eyesight, total loss of hearing. And so the individual picks between $10,000 and $50,000. And once they unfortunately suffer from a critical illness, we pay them out that cash value. That also goes down to a cancer diagnosis as well. You know, sometimes we have individuals who don't want to get treatment and they on cash. We also have some people that want to explore other kind of treatments that are not approved by the FDA that insurance doesn't typically pay for. So they like to take out this cash value so they can do that. This $10,000 unit, anybody ages 18 to 35 years old is going to be 86 cents a week. So very affordable just to protect your family for a small amount. Any questions on this one? All right, so the last one that we have is our Accident Protector Max, which is free for the entire family, 24 hours a day, whether they are on the job or not. So how this plan works is once the individual receives an injury from an accident, anything from major to minor, as long as they see emergency treatment within 3 hours, we're gonna pay them up to $5 on that bill. I always like to give people examples, so if you go into the chiropractor because you had an accident and hit your back, it was $100, we're gonna send you $100. If you go into the ER because you broke your arm, and it was $1,000, I'm gonna send you 500. So we're always gonna send you up to $500 on that bill. Also, if you are in the ER for 24 hours, we're gonna send you initial hospitalization benefit of $1,000. If you have a daily hospital confinement, that will pay you $150 to $500 a day, and that just depends on how long you hold the policy with us. And then hospital intensive care is always gonna be 2 times the daily limit that you're receiving, and they do compound on top of each other. This does act as an accidental death and dismemberment policy as well for the entire family. Any questions about this one? All right, this does run $27 a month for a family. They can use it however many times they need to within a calendar year. So how this works is I'd like to come in and navigate one of your employees one-on-one, ask them questions about something that they already have in place, and then offer them those 2 free policies, that accidental death, that non-insurance discount card. Offer those policies to help fill their needs. If they want them, great. If not, that's totally fine. We're just happy to start this relationship with you guys. But yeah, that's basically it. And then I usually say when I can come back, so it hasn't been thrown off, because I'm not gonna tell you when I'm gonna come back. You guys are gonna tell me.
So again, we'll have to, put an action item on the agenda for next week.
Yeah.
Well.
Yeah.
We'll just do the vote.
Absolutely. So I did give you guys a packet of everything that we have included. I can send you an email so it can be virtual if there's anybody that wanted that. Otherwise, my business card is in there. If you guys have any questions, would be happy to take care of you guys. We take care of quite a few counties here in the state of Iowa, along with Aflac. Our quality are very well together. It is being an option. Aflac is, strong in their cancer and accident programs, and we're really looking at that life. So it's transportable for them ever whenever they leave that county. All right.
Thank you.
All right. Yes.
Good.
Thank you.
Thank
You guys
you.
have a beautiful day.
You too.
Okay, discussion and approved claims.
I'll make a motion to approve the claim.
Been moved to approve claims. Is there a second?
I'll second it.
Been moved to second.
The total is, I'm gonna give you the numbers, 220,911.24. So $220,911.24.
Okay. Discussion. All those in favor say aye. Aye. Opposed, motion carries. Public comments?
Yes. What would comment on the sheriff donating the Durango to the town?
Sure.
Tama
Ambulance.
ambulance. The policy you was talking about, that's a county policy?
I don't know. The only thing I could find was state law.
Oh, well, I mean, the one that, said that they had to sell it or trade it in.
Yep, that was state law. I didn't find
That was
anything.
state law.
I didn't find anything in county policy.
Okay, because I thought if it was county, I'd say possibly next week you could change your policy and.
Sure. I couldn't find any county policy.
Through the decision by the court, of course.
Correct.
Yeah, okay, I just thought I'd see if it was.
I didn't see it in any ordinances.
Yeah.
That was the only thing that it did mention that you could, the sheriff could, donate, to private nonprofits vehicles that they had found abandoned. That become their property. What do we do with the secondary roads equipment when we decommission it?
Consignment?
Yeah, those on auction, or usually for like trucks and stuff, we traded in.
Yeah, it's like auction or trade in. That's the only thing that I know that's approved, that's don't.
Maybe it'd make it easier for them to donate it to a nonprofit.
Yeah.
Which I wouldn't have a problem with.
Yeah, I don't think any of us do either, as long as it's legal.
Yeah, okay, thank
Yeah,
you. Problem.
good.
Laura Wilson from Geyser, two topics. The first is I have previously worked for a company that did offer supplemental insurance. And I think that does help employees because they have an option and informational sessions right in front of their face that they can,
Super.
that they get information from and it's not. Don't do to look into, and if it doesn't cost the county anything except maybe a little extra payroll work, I don't know that that would be a bad option for your employees. You do wanna consider how much that payroll cost would be to have it go through payroll deduction. And something like that. So I think it'd be good to do one or both options. I think the company I work for did have two options that people could pick from. I wouldn't say, go for 10, because that's a little excessive, but if you have a couple that people could look over and decide if they want to do that, I think that'd be something beneficial. I know we already have great benefits for the county, but if it doesn't cost the county anything to join that aside from the payroll reduction section, I think it's something to look at. The other topic is, for the public health budget. I do know that they offer services that people pay for, and if you take away their budget and their personnel, those people are gonna have to go somewhere else to pay for that, and that'll be a longer wait time. It would be less coverage. It would be, more expensive because they would have to be driving further to get there. And I think taking away that option for county citizens would be detriment to citizens of this county. So I'd like you to consider, not cutting as much from that board of health budget. Thank you.
Karen, I am, grateful that you're going to table the, time clock systems. Michelle and Karen have really, gotten dumped a big load of stuff to do. I mean, just the 2 months that we've been going again, and as have the 5 of you, and I'm also glad that you are going to take time to consider the added insurances, which any will do a lot more work for Michelle, but maybe right now she doesn't need any more work to do. Because some of this other stuff is very, very important as well. People can always buy insurance off on the side by themselves. So I am grateful that you are going to table all those items for a little bit longer. Think about it. Good for you.
Anybody else for public comments? Okay, close public comments. Alrighty. Guess we will, take a motion to adjourn. We do have a budget work session. Following this meeting, we discussed probably and then, we have a work session with Tama County Board of Health at 12 over at their offices, so that everybody knows. And, with that, take a motion to adjourn.
Make the motion to adjourn.
Second. All those in favor say aye. Aye. Motion carries 9:53.
Yes.